Hey, good afternoon. This is Selah Craven with Whole Family Medicine. I am the clinician and owner of this wonderful practice up in North Buncombe County. And today I want to talk a little bit about spike proteins and how we are going to address our immune system in light of the changes that have occurred since 2020 and the presence of COVID in our life. So, for the last number of years, I have continued to support patients in increasing their vitamin C through elderberry syrups or elderberry supplements using the K12 Bliss throat defense product from True Botanica, or any product that has the K12 Bliss Streptococcus salivarius probiotic that lines the throat so that, we have that first line of defense right there, along with supplements like NAC, cod liver oil, grass-fed beef liver, encapsulated or eating it, as well as other homeopathic remedies through anthroposophic pharmacies and such. However, we're still getting really sick. We're using the herbs, we're using the Gaia product, the immune activator with the echinacea and the elderberry and the it just went out of my head. It's the elderberry and the andrographis, right? And a little bit of ginger, using straight andrographis, using all kinds of different supplementations that have always worked, and yet people are getting sick and remaining sick. They're having migrating fevers that come and go over weeks, and it's time to kind of look at this from a new angle. So I have a couple pieces of information I wanted to dive into. One is that there are two families in the practice who have both simultaneously started using a product that is sort of pricey, but if it keeps you well and it keeps you able to remain active in your life, it might be worth it. But these two families, one family has 3 children, one family has 2 children, they have small children, they're out in the world, they go to church, they go to activities, they go to school. Neither of these families encountered the intensive viral process that many of us encountered during the month of December, with the severe body aches, the nausea, the vomiting, the tendency of it to develop into pneumonia, lots of deep chest cough, spasmodic coughing, things like that. Neither of these families got any of these symptoms, and they said things to me like, well, the last time I was sick was in June with a little cough or cold. So knowing that 2 families have been using this product is somewhat helpful, and the product is through an organization called the Wellness Company, and they have 2 products. One is the adult formula, and it's called Spike Support, and the other is the kids formula, and it is called Kids Spike Support. Okay, the children's dosage is $44.99 for a 30-day supply, and the adult dosage, depending on if you become a member or not, can be $64.99 or $54.99. Now, it's a $10 a month to be a member, so theoretically, you're going to end up paying about $65 a month for this adult dosage. There's obviously the opportunity to use it when you know that you're exposed to something, use it when only during the winter months, use it once you get sick. But my understanding is the idea is that you're taking the supplement every day. The adult product has selenium, black sativa extract, iris sea moss powder, green tea extract, nattokinase, and dandelion extract. Obviously, the nattokinase is a spike inhibitor. The dandelion extract is a liver support, which is going to support your detoxification strategies. The selenium helps reduce stress and aids the body in repair and recovery. A black sativa extract may help cellular repair. Green tea is a free radical scavenger. And the iris sea moss is mineral rich and it helps to rebuild damaged muscle and tissue. Now, the children's formula is very different. It is has almost completely different components. Unlike I think dandelion is the only common component. And these are chewable, which is great for the kids. Let's see. The children's spike product is vitamin C, which we know is important. And it is dandelion extract, pomegranate peel, which is supposed to inhibit viral replication. It may also prevent spike proteins from binding to your cells. Rutin is known to inhibit the spike protein and support the reduction of viral replication. Bromelain is a natural antiviral. And papain, I don't know if I'm saying that right, it's Papain or papin, has been reported to break down spike proteins and prevent viral replication and boost the immune system. So it looks like there are 60 servings per container for a 4 to an 11-year-old in this dosage. So, maybe $40 for 2 months for a child isn't such a bad idea. Maybe we need to put our kids on this and the adults need to do other things. Looks like there's not too many other ingredients that would necessarily be unsupportive to the body. It does have ascorbic acid in it, which isn't my favorite thing in the world. Okay, so I wanted to tell you about that product, but then it made me go to the FLCCC website, which is the Frontline, what does it stand for? The Frontline COVID Care Collective or something like that. I've been following their recommendations for years now. They have now created treatment protocols for prevention, and they no longer have just COVID. It's COVID, it's RSV, and it's flu. So where we used to be do this for COVID, do this for RSV, and do this for flu, they're saying do the same thing for everything. So that means something to me. And what it means is that a lot of our viral processes are basically needing the same kind of support. And maybe our immune system is so weakened from COVID that we are going to need that same kind of support every time we encounter a virus, even a cold. So it's worth taking a look at. I took a look at the children's recommendations and made a little print off that I will email to members about kids and COVID. Some of the highlights that are important to understand is that children have a different immune responses than adults. This is what prevents them from going really severe with COVID. They have less expression of the ACE2 enzyme, which binds to the spike protein in COVID, and it helps it to enter the cell. So like ACE2 inhibitors are like the lisinopril and things like that people use actually for blood pressure and kidney protection. And they were also using these products in COVID in the early days. Kids also have a highly functional innate immune system, which provides general protection against a variety of infectious agents. And they have fewer risk factors like obesity and other diseases, which make many more adults more vulnerable to COVID. So some of the primary treatments for children in COVID were melatonin. Want to make sure that we get the extended release. The short release can cause nightmares and things like that. It looks like the dosing is 0.5 to 1 milligram per kilogram per dose, although there's also report on the same breath. They also say for infants it's 1 milligram, older children 2.5 to 3 milligrams, adolescents 5 milligrams. However, if you have an infant who's 22 pounds, they could take a 5 to 10 milligram dose based on this weight ratio of 0.5 to 1 milligram per kilogram per dose. So I'm looking at it going, well, start with the infants at 1 milligram and older children at 2.5 or 3, and then increase if it's not effective, as long as they're tolerating it. The most common side effect is morning sleepiness. Other side effects reported like headaches, dizziness, and diarrhea. It's also really supportive of children with autism because they often have disrupted melatonin production, and they might be able to go higher. So consult with me or your provider, whoever that is, about using melatonin in autism. The next recommendation that they added was vitamin C. Also in this write-up, I will have the appropriate dosages just to give you an idea. Looks like 0 to 6 months, 40 milligrams a day. 1 to 3 years, 15 milligrams a day, 4 to 8 years, 25 milligrams a day. But you can go up to 500 to 2,000 milligrams a day when children are sick because they benefit from these antioxidant effects. We know that it's very good antiviral, it's antioxidant. Of course, vitamin C is found in red, orange, and yellow fruits and vegetables. So, eat your oranges. I talk a lot about, or I think a lot about vitamin C in terms of like a lot of vitamin C products, even the high-end ones, it's just ascorbic acid. And if you just take ascorbic acid, it interrupts the Krebs cycle or the citric acid cycle in the body, which is responsible for making energy out of the nutrients that we take in. And when you're talking about a time when we're all sort of depleted and our immune systems need to rebuild and we're really focused on mitochondrial health, I'm under the impression that we need to be thinking about how we're going to improve our energy, not deplete our energy. So you can get food-based vitamin C with lots of rose hips and the acerola cherry and other food-based sources of vitamin C. You can also focus more on ascorbic acid with those things, or you can get purely food-based vitamin Cs. You can also look at the liposomal vitamin C, okay? And that puts the substance into tiny fat bubbles and allows it to come into the bloodstream in an easier way. So basically, just don't take your vitamin C, don't make your vitamin C a process of isolating a constituent, just like we do in pharmacology. We really want to take the vitamin C in with all the other good elements that typically come with it. So that's the vitamin C. Vitamin A is an excellent antiviral that's actually been used to treat measles. I recently heard a report that there was some measles up in Pennsylvania. I like to use cod liver oil to get my vitamin A. Of course, all these protocols have high doses of vitamin D on there. And if anyone's listened to me talk at all in the last couple of years, they know I do not like synthetic vitamin D. So I would rather get my vitamin A from cod liver oil that gives us that perfect balance of the A and D. 1 tablespoon of jigsaw cod liver oil has 1,100 micrograms of vitamin A. A 6-month-old needs 400 micrograms a day. A 12-month-old needs 500 micrograms a day, so that's about a half of a teaspoon. A 1 to 3-year-old needs about 300 micrograms of vitamin C. A 4 to 8-year-old needs 400. 9 to 13-year-old needs 600. That's 7 to 10-month-old with 500 micrograms. It must be a mistype. Anyway, up to about 900 micrograms for a teenager. So I usually take a teaspoon of jigsaw cod liver oil, which is 1,100 micrograms a day, because I'm breastfeeding. And the jigsaw cod liver oil available through Full Scripts is really wonderful. Quercetin is a mast cell stabilizer. It prevents the release of inflammatory cells and histamine. It has a direct virus-killing property against the viruses that cause COVID, and it's a potential antioxidant and anti-inflammatory agent that's well tolerated in children. It's often available through lots of fruits and vegetables, but True Botanica has a really wonderful Quercetin Plus product. It's in the mid-$20 for 60 capsules for whole family medicine patients. I recently opened a capsule and tasted it just to see what it tasted like, and it was really benign, really easy to take. So children can take it. Adults would take 2 capsules a day. Children would take 1 capsule a day. And the really cool thing about this medicine is it's a blend of a supplement and an anthroposophic remedy. So you have the anthroposophic remedies for allergies and barrier and the need to create a little bit of a buffer between you and the world. So that can be a physical thing or an energetic thing. Those of us with allergies have high reactivity. We also tend to be highly sensitive people who need a little bit of a shell. So the homeopathic oak bark and the homeopathic lemon quince that's in the Quercetin Plus product is really helpful on an energetic and a physical level. And it also has the nettle and the fenugreek in there. So not only is it going to support you when you're sick, it's also going to help with allergies. Finally, ivermectin. Children in many countries around the world receive ivermectin regularly as a dewormer. Experience suggests that this medicine is safer than aspirin. Safety and effectiveness in pediatric patients weighing less than 33 pounds has not been established, according to the package insert, although one published paper suggests that it's safe under 33 pounds, and the body weight limitation would apply to children on average less than 3 years old, who usually tolerate COVID quite well. So basically this is saying that FLCCC recommends that you use it above 3 years old. And it's important to mention that the American Academy of Pediatrics does not recommend the routine use of ivermectin in children for COVID at this time. So they're using pediatric dosing guidelines. Usually it's 0.2 to 0.3 milligrams per kilogram per dose for parasitic treatment, and that's been used all over the world for a long time. A lot of other doctors have recommended up to 0.4 milligrams per kilogram per dose. I'm talking quite a bit, making me cough. So anyway, that's the rundown for the treatment for COVID for children. Now for adults, we've got different things to use. We also have things that we need to consider for long haulers and COVID vaccine injury and things like that. But I just wanted to start by just sharing these pediatric recommendations. I do have for my patients recommendations for specific melatonin products that are available. That would be long release for affordable rates. So again, melatonin, vitamin C, vitamin A, and ivermectin and quercetin are the most important things to have on hand. Or, you can use the Kids Spike Detox product as well. It's just a matter of what's the most affordable thing. All right.